Welcome back to the deep dive. Today, we are moving beyond, just the standard camera on a scope. We're going into this really fascinating world where a bit of simple chemistry can act like a diagnostic superpower.
Exactly.
Usually, when we think about looking inside the esophagus, it's all about high-definition cameras. But what happens when the lining looks, well, pretty much normal, but the patient has symptoms, or maybe the disease is just too subtle to see?
Right.
So our mission for this deep dive is to get into a technique called chromoendoscopy, and it uses something pretty common, Lugols iodine. We want to figure out the chemical reaction, how it finds things like cancer or reflux, and what makes it tricky to do.
That's the core of it, really. We're looking at how this solution, something you might even remember from a high school biology class, becomes this incredibly precise diagnostic tool. For anyone listening, you'll walk away knowing not just that they spray iodine, but the actual reason why it works and what safety steps are absolutely critical.
Let's start with the big picture then. What is the most important reason to, bring this dye into the procedure room?
The primary, and I'd say high stakes, application is for screening and diagnosing squamous cell cancer.
SEC.
SCC, okay. Our sources are really clear on this. It's still one of the most common esophageal cancers around the world, especially in places with high rates of smoking and alcohol use. And catching it early, well, it changes everything for the prognosis.
So wait, if they're already in there with a scope, with a camera, why do they need the stain? Does that mean early stage SEC can be missed by just looking?
Precisely. That's the whole point. Early lesions can be incredibly subtle. They can be flat. They can just look like a little bit of inflammation.
Hard to tell apart.
Very hard to tell apart. The visual clues just aren't reliable enough in real time. But the stain changes the game. It's used for screening in high-risk groups or when a cancer is already suspected. And it does more than just find it. Let's say a tumor is confirmed. The iodine spray is vital for planning what to do next. A surgeon has to know the exact boundaries,
Yeah.
How far has it spread sideways?
Ah, so it draws a map for them.
It creates a perfectly clear, visible border. It ensures that when they go to resect it, they get all of the affected tissue, all the bad stuff.
That makes complete sense for something as serious as cancer. But you also mentioned a secondary use that sounds a bit less obvious for something called non-erosive reflux disease, NERD.
Yes, and NERD is, well, it's a perfect example of a stealth condition.
How so?
So a patient comes in, they have all the classic symptoms, heartburn, reflux. Normally, an endoscopist would expect to see erosions, right? Visible acid damage.
Yeah, you'd see the damage.
But with NERDARD, the patient feels all the pain, all the burning, but when the scope goes down, the lining looks totally normal. Pink, healthy, no visible erosions at all.
So all the symptoms, but zero visual evidence. How on earth does iodine help with that?
Well, the thinking is that even without those big erosions, the acid is still causing these really subtle changes at a cellular level. It's affecting the cell structure and especially the glycogen content.
Glycogen. Okay.
So by spraying the iodine, clinicians can sometimes see these tiny changes. They show up as small, unstained patches that you'd never see otherwise. It gives them actual objective proof for what was just, a patient's complaint before.
Okay, let's unpack the science here. This is the aha moment for me. How does this common chemical, this iodine, suddenly become a detector for abnormal cells? You said it's all about glycogen.
You've hit it. That is the molecular key to the whole procedure. It really just leverages a basic chemical property. Think back to a science class. Maybe you put a drop of iodine on a sliced potato. What happens?
It turns black or really dark blue, right?
Exactly. Lugols iodine reacts with long-chain carbohydrates,
Yeah.
starch in a potato, or its human equivalent, which is glycogen. It causes this huge color change, and we're just applying that same principle inside the esophagus. See, the normal lining of the esophagus, the squamous epithelium, is designed to store energy, and it is absolutely packed with glycogen.
So it's full of fuel.
It's full of fuel. So when the Lugol solution is sprayed on, it gets soaked up by these healthy cells. It reacts with all that glycogen, and the entire normal lining stains this uniform, rich brown color.
So healthy tissue wears this brown coat because it's full of carbs, which
Mhm.
means, here's the clever part, the disease is revealed when it doesn't stain.
That's the beautiful, ingenious part of it. When that normal tissue starts to become abnormal, whether it's from cancer or just chronic inflammation, the cells, they basically lose their normal functions. And that includes storing fuel efficiently.
They become glycogen negative.
They become glycogen negative. They've lost the very thing the iodine needs to react with. So the endoscopist sprays the lining, and against that beautiful brown background of healthy tissue, the diseased areas just pop. They stand out as these stark, obvious, unstained patches.
It's like a photo negative. You're not looking for something that's added, you're looking for what's missing.
Yeah.
That's really elegant.
It is.
Now that we get the chemistry, what about the logistics? How precise do you have to be? I mean, it's a chemical going inside someone. What's the protocol for the solution and the equipment?
Precision is absolutely critical here because, as we'll get into, it's an irritant. The source material is very firm on this. You need a 1.2% solution of Lugols iodine.
1.2%. That's very specific.
It is. And it usually means they have to dilute it on the spot. You don't just find 1.2% solution sitting on a shelf. So they'll have a concentrated stock, and they have to dilute it very carefully with saline in the syringe to hit that mark.
And using one that's too strong would be a problem.
A big problem. It would really increase the risk of irritation and, frankly, patient pain.
Okay, so they have the syringe with the perfect solution. How do they actually apply it to the esophagus wall?
They use a special piece of gear. The syringe connects to a very thin, flexible tube called a spray catheter. That catheter gets threaded through the working channel of the main endoscope.
Ah, so it goes right through the scope itself.
Exactly. And the technique requires a bit of skill. They guide the scope down to the GE junction, where the esophagus meets the stomach. Then, as the endoscopist slowly pulls the scope and the catheter back out, they gently mist the iodine onto the lining. It's a very even, gentle spray to make sure the entire surface gets coated.
That sounds precise, but also messy. If this stuff stains tissue brown, I have to imagine it stains everything else, too.
Oh, absolutely. And this is where the practical warnings are so important. Lugol's iodine is a powerful stain. It will ruin drapes, bed sheets, clothes, anything it touches. The whole team has to be ready.
So lots of gauze.
Lots of gauze, disposable pads. They have to be ready to clean up any drips around the patient's mouth or chin immediately before that stain sets. It's an amazing tool, but you have to respect it.
Okay, so we're spraying a known irritant onto a very sensitive lining. We have to talk about patient safety. What are the risks, and what do they do to manage them?
This is probably the most important part for you to understand if you're ever near this procedure. Because it is an irritant, the most common complaint right after is heartburn. A burning sensation. It's a temporary chemical inflammation.
So how do they deal with that? Once they have the pictures they need, do they just leave it there?
No, best practice is not to leave it sitting there. It's highly recommended to wash it off or at least dilute it once the diagnostic part is over.
With what? Just water?
Usually just by spraying saline through the same catheter, or sometimes a special washing solution. In fact, one really interesting technique that's been studied is spraying a solution of N-acetylcysteine right after the iodine.
N-acetylcysteine, I've heard of that. What does it do?
It seems to neutralize or wash away the residual iodine much more effectively. It specifically helps cut down on that post-procedure irritation and the heartburn.
That's a clever extra step. But are there any patients who just shouldn't get this at all?
Yes. Two critical absolute contraindications. They have to be screened for these before they even start.
Okay, what are they?
First, pretty obviously, anyone with a known allergy to iodine is out. Introducing it right onto the mucosa could trigger a very severe allergic reaction.
Right. No iodine for the iodine allergic. Makes sense.
The second one is also crucial. It must be avoided in patients who have thyroid disease.
Thyroid. Why?
Well, think about it. The thyroid gland uses iodine to make its hormones. If you suddenly dump a relatively large dose of iodine onto the mucosa, a lot of it gets absorbed into the bloodstream. For a patient with an already overactive thyroid, that sudden iodine load could trigger a serious, even life-threatening event called thyrotoxicosis.
Wow. So it's not just a local reaction. It can have systemic, body-wide effects on the endocrine system. That makes the patient's medical history just as important as the spraying technique itself.
Absolutely. The whole thing rests on having solid clinical protocols and safety checks in place.
So to wrap up this deep dive, we've seen how this really ingenious targeted application of a simple stain lets endoscopists see cellular health. And it's all based on whether or not cells have stored carbohydrates,
Right.
glycogen.
Right. We went from this huge global need to detect cancer all the way down to the tiny detail of a single cell's ability to store fuel.
Yeah.
And if you connect that to the bigger picture, it just shows the power of using basic biology and chemistry to do high-level medicine. It gives the doctor solid, objective evidence where before there was maybe just a hunch, whether that's finding an early SCC or just confirming the subtle damage in an art. It literally brings the invisible into the light.
It's the ultimate diagnostic shortcut, using a known chemical reaction for a life-saving reason.
It truly is. And here's something for you to reflect on. The very mechanism that makes healthy tissue stain that nice uniform brown, that presence of life-sustaining fuel, glycogen, is the exact same thing that helps diagnose a deadly condition, simply by its absence. Understanding that inversion, that simple difference between brown and not brown, that is the key to the power of Lugols chromodoscopy.